This is Dr. John Wycoff with another podcast on Pathway to Wellness with yours truly, Dr. John Wycoff. And thank you for listening. Today we're going to go further into this world of ever-evolving weight loss and talk in more detail and depth about the GLP-1 receptor medications. These are certainly in the news, they're on the internet, you're seeing them, you're seeing the good and the bad. And I'm going to try to help sort through kind of the second level of GLP-1 weight loss issues. We're going to call this GLP-1 update or GLP-1 202, however you want to look at it. So let's first talk about trying to understand a little bit more about what these GLP-1 drugs do, how they work, and why they're getting such interest. Well, the GLP-1 drugs, GLP stands for glucagon-like protein 1. It's a receptor agonist, means it binds to the GLP-1 receptor on the cell membrane. And that doesn't really, something you need to really understand is maybe more advanced biochemistry than you ever need or want to know. But what is important to understand at some level is every cell in the body has GLP-1 receptors. That means the cells in your heart, your liver, your intestinal tract, your brain, your muscles, your pancreas, all have GLP-1 receptors on the cell membrane. And what we know in people that have trouble with weight loss, prediabetes, non-insulin dependent diabetes, type 2 diabetes, is that they're resistant to the hormone insulin. Part of this is because of genetics. Part of it is because we live in America and there's a lot of chemicals and synthetic estrogens in our diet and in our food supply. But we develop this resistance to the hormone that's critical to move blood sugar from the bloodstream into the cell so you can make energy. That's what insulin does. And if you have insulin resistance, that extra blood sugar stays in the blood vessel. Your body has to do something with it or it's actually fatal. So what does it do? It converts it into fat. And usually it's fat around the belly, usually below the belly button above the hips. That's that little roll that many women see. And they start blaming it on menopause or perimenopause. But really what's going on is that they're developing some mild degree of insulin resistance. The GLP-1 drugs specifically tend to undo that resistance. So I'm sure you've heard of the GLP-1 drugs. I brought in some examples that will demonstrate how they're used. This is Ozempic. Ozempic was the prototype, the initial second generation GLP-1 drug. And then this is Wegovy. These are administered as a very, very small, once weekly subcutaneous injection. These are both auto-injectable pens, so they're very, very easy to use. And I'm going to show you, you can see here with the pen, this is the actual medication semaglutide or semaglutide, depending on how you want to accent it. This is what you would get at the pharmacy if you were to go in and get a prescription for Ozempic. It comes with disposable individual use needles. You screw the needle on. On the front of the pen is a dial. You dial up your dose. You can control that. We would help you. This would be 0.25 milligrams. You take off 2 caps. Very important to take off 2 caps. And you push this into your skin, either your belly, your thigh, or your arm. And it's got to kind of indent the skin. You got to push down, make a little dent. Hold it there. Push the button and hold it down, and you'll see the semaglutide come out at that dose over about 5 seconds. It clicks. When it's done clicking, you let go. You can put the cap back on. You don't have to. You got to be careful you don't get punctured. Put this on and dispose of the needle appropriately. So that is how the Ozempic pen works. The Wegovy pen, which is the same exact medication as Ozempic, is a little different. it comes in a single-use pen. You pull the end off, you take the pen, and you push the pen straight down, and it fires. It's that simple. It takes about 5 seconds, and the medication is administered, and you are done. You dispose of the pen at that point. This is a pen that is given to us for instructional use only. Again, they're administered under the skin, very, very small needles, once a week. We can also get the semaglutide or the tirzepatide, the other brand of GLP-1 drug made by Eli Lilly, in a vial form, and we can use a little needle like this, and we can draw up that vial to the amount we need. And it's again administered once weekly, just under the skin, either in the front of the thigh, the belly, the abdomen, or the arm. Easy to use, very minimal, if any, discomfort. Most people don't even feel the injection. Even if you have needle phobia, usually we can get people to work through those issues, and you begin to see the effects right away. So what do they do? So what is all the hype? Well, people may say, well, Dr. Wycoff, you're a functional medicine doctor. I thought you were anti-medication, and really nothing could be further from the truth. I am for appropriate medications and appropriate understanding of how they work and how they can help you get healthy. The GLP-1 drugs are an absolutely amazing class of medication. And we'll talk a little bit more about safety in a minute. But of all the medication classes I've seen in my career, which spans over 40 years, not one class stands out as effective and helpful to people as this class of drugs. So not only do we see weight loss and improved blood sugar or glycemic control, we see now case studies of significant reduction in heart disease or stroke, upwards of 25 to 32% reduction in patients taking GLP-1 drugs. There are ongoing studies that are now looking at the progression of dementia or prevention of dementia, Alzheimer's dementia, in patients using GLP-1 drugs. Another area of excitement is with addictions. People that have addictions to alcohol or other substances may find that those cravings go almost completely away using GLP-1 drugs. In my world, we see a lot of people, children on the autism spectrum scale. I think almost 100% of them have insulin resistance. Not that they should be on a GLP-1 drug, but understanding that insulin resistance is part of their issue is important to know. Because remember, the GLP-1 receptors are on every cell. So the effects that the drug has is on every cell in the body. Well, what are those effects? Well, we know that the GLP-1 drugs works on the pancreas and increases the production of insulin. And that usually helps the equation along. But it also reduces the production of glucagon. You can think of glucagon as the anti-insulin in the liver. It makes your cells more receptive to insulin. So that helps with that resistance. We really want the musculoskeletal fiber cells to have more sensitivity, which it does, but also the cells in your heart and the cells in your brain have insulin receptors. And we know that the effect that the medication has on the brain is it does tend to reduce appetite. So there's kind of a false narrative that goes around about the GLP-1 drugs that they're appetite suppressants. Really, nothing can be further from the truth. They really do not suppress appetite like you would think a medication like phentermine or the fen-phan or some of the older type medications did. They reduce hunger by slowing down motility, or how things pass through the small intestine, specifically the ileum and the jejunum. So what that does is that slows down emptying of your stomach, probably puts it back actually to a more normal rate of emptying, and you feel full, so you eat less. sometimes your appetite is completely gone. We're going to talk more about how and why it's important that you have a specific eating program if you're on a GLP-1 drug. But satiety, or the feeling of being full, is achieved early on with these medications. So, and it's the effect of the drug on the GLP-1 receptors in the intestinal tract. So there's a myriad of effects, many exciting effects that are positive. What about the negative? You say, well, Dr. Wycoff, there's got to be some negative side effects, and there are. And I tell my patients this. Typically, they're gastrointestinal side effects, nausea, bloating, diarrhea, maybe even constipation, gastric reflux. Now, those symptoms occur in probably 50 to 75% of patients, but they tend to be mild, and oftentimes they are self-limited, meaning they will get better with time. Your body will adjust to them. But many people keep finding that they have some nausea on the second or third day after each injection. And there again, that goes to the fact that your stomach is not emptying at the rate that you may be used to. And it's not necessarily an intolerable nausea, but it can be there. The most nuisance side effect we've seen has been diarrhea. Sometimes the diarrhea can be profuse and significant. And I've had experiences with over 300 patients on GLP-1 drugs. We've only had 2 have to stop because of the side effect of diarrhea. That's the only side effect that has driven any of my patients to have to stop using either Ozempic, Wegovy, Mounjaro, or Zepbound. Those are the 4 common GLP-1 drugs. So if you have a practice like Wycoff Wellness that deals with functional and integrative medicine, that's what we do here in East Lansing each and every day, is we can help you through those side effects. Whether we can change the dose, we can change your diet, we can help you problem solve and try to get through that side effect. And most of the time we can do this. You probably hear something called microdosing. And this is the type of dosing we do at Wycoff Wellness. That means we're going to use the least amount of medication to get the desired effect we're looking for. The desired effect may be improved blood sugar control, it may be reduction of insulin resistance, or it may be weight loss. But we're going to use the least amount of medication, some people call that microdosing, to help us achieve that goal. So one of the things we do at Wycoff Wellness is we do a body composition test at your first visit. We help you define how much of your body is lean or muscle and how much is fat, how much is water. We want to try to affect your weight loss in such a way that we maintain muscle and lose fat. You have to have some fat in your body, but too much fat is a problem. And the BIA test, the bioimpedance analysis, is a very painless, simple test. It takes just a couple minutes to do. That tells us what your body composition is, and we can compare that visit to visit, and we can monitor how much muscle you're losing, how much muscle you're gaining. And we'll talk about ways to preserve or gain muscle. So we've talked about how they work. You've seen the pens. We've talked about dosing. The one thing that I think a lot of people don't understand is that you need support as a patient when you're on these medications. At Wycoff Wellness, we're committed to helping you and providing that support. How do we do that? We give you 24/7 availability to our patient portal online at wycoffwellness.com, WYCOFF wellness.com. You establish a password. It's a secure HIPAA-compliant portal, and we are able then to make sure that we can communicate effectively. So if you have a problem, no matter how simple it is, you just drop me a message. I answer all of those messages, usually within 24 hours. You can call our office during office hours. My staff is very knowledgeable about GLP-1 drugs, about the insurance aspects, about the cost options and choices you have, and also side effects and how to make some changes. So they can oftentimes help you. Or you can come in and schedule an appointment, and we schedule all of our patients back at regular intervals to see me. to personally come into the office, have a BIA test, get the appropriate lab work that they need to have done. We do like lab work before we start, some very basic tests that your insurance will cover, and then we will monitor that periodically as we need to moving forward. So support is really important, and I think with a lot of the online programs, you just don't get that support. You may be getting a compounded form of the drug, which is maybe fine. We use compounded forms every day in our practice, but we know the compounders that we're getting the medication from. We trust them. We know they're making a quality product. They're going to handle that product in a sterile, quality way, and they're going to deliver it to you in a way to maintain the viability and efficacy of the product. So that is really critical. And then, like I say, we're going to have the support. Let's talk a little bit about pricing, because everyone talks about how expensive these medications were or are. And up until about 10 days ago, they were quite expensive, and more and more insurances were not covering them. So our first option when we see a patient is to say, listen, do you know if your insurance will cover this medication or not? Some insurance companies do not cover weight loss medications. If you have type 2 diabetes and your labs support that, oftentimes your insurance will cover the prescription for Ozempic or Mounjaro. And we can talk about the pros and the cons of those two medications. But for today's discussion, we're talking about GLP-1 drugs ubiquitously. They're very similar. There's some subtle differences. There may be some slight advantage in one or the other, but not major, not significant, and not really germane to the discussion today. So you may know if your insurance does or does not cover. If it's for weight loss, the majority of traditional insurance plans will not cover any of these drugs. And the pharmaceutical companies have done a really good job of marketing their drugs. So we have the two Novo Nordisk products, Ozempic and Wegovy, exactly the same drug. The drug in here is exactly the same, semaglutide, but they're packaged and dosed slightly differently. So the FDA has approved Ozempic for treatment of type 2 diabetes, Wegovy for treatment of obesity. Obesity is typically defined as a BMI above 30, but oftentimes the BMI must be above 35 for your insurance to even consider covering it. So one of the things we'll do when you come in to Wycoff Wellness, we'll do your evaluation, we'll review your labs, we'll make sure you're a good candidate, we'll make sure this is what we want to do, and we're going to give you your first semaglutide pen, which will last 6 to 8 weeks, free, part of your consultation. And then we're going to process the prescription either for Ozempic or Mounjaro or Zepbound or Wegovy. And we're going to see if that process is fruitful for you. We really won't know until it goes to your pharmacy, and your pharmacy then can check with your insurance. Oftentimes there's a pre-authorization process. We will take charge of that for you. We will be in contact with a group called Cover My Meds. Usually it's done electronically or by fax, and give them information about your weight, your blood pressure, your cardiovascular risk factors, your other medical issues, your lab results, your blood sugar, your hemoglobin A1C, things like this. And they will make a determination. Either yes, they will pay for it, or no, they won't. And we're there to help you and support you in that process. And initially, we'll do all of that work ourselves. If it goes to a second or third level appeal, we're going to let you kind of take the ball and move that forward. But normally it's pretty simple. Either it's covered or it's not covered. So let's assume that you're in that group, the majority of people, where it's not covered. Not the end of the world. So recently, as I said, the Trump administration went to the manufacturers and said, listen, you're price these medications out of the market for the majority of people because a 1 month supply of Wegovy or Ozempic was between $1,200 and $1,400 cash. That was just prohibitive. So what Wegovy has done is that if we get the medication through the Wegovy pharmacy, the Novo Nordisk pharmacy, your first 2 months of Wegovy, any dose, it's just $149. It's really an amazing cost savings. On the third month and then ongoing, it does go up to $349, but never goes higher than that. So the most you would pay for the actual name brand Wegovy is $349. Zepbound, the Lilly counterpart, is right now at $499 a month. But as I said, this all changed 10 days ago, November of 25. I'll probably need to revisit this with another podcast because I have a feeling the price is going to be driven down further. We also can get the compounded form where we have a vial and we use the little individual needles. It's in the range of about $250 to $300 per month, depending on the dose, the strength, and the medication. So we have options available for you. If you have a health savings account, you can use that. You certainly can make this a deductible expense as a medication expense. So there are ways to make this work for you so that you're not financially burdened excessively. Okay, so that takes care of the pricing. As again, the pricing is subject to change. I advise you to contact your insurance and see what they may or may not be able to provide to you in terms of support. Let's talk about diet. So this is an area of intense debate. I really feel, and I think the literature supports me, that if you want to maintain muscle mass, lose weight with the GLP-1 drug, you need to be on a high-protein diet. Okay, you say that's easy enough, Dr. Wycoff. I like meat, I like eggs. But what I'm talking about is much more than the typical recommended daily allowance of protein. So if you go to the Health and Human Services website and Google RDA protein per day, you usually say about 0.36 grams per pound or 0.8 grams per kilogram. So, and that's usually based on your goal ideal weight. Let's just say your ideal weight, you want to be 200 pounds. 0.36 grams is going to be around 65 to 70 grams of protein per day. The amount of protein that I'm talking about is about 1 gram per pound. 200 grams for an ideal body weight of 200 pounds. That is a lot of protein. So to give you some perspective, if you were to eat an egg is a very high protein rich food. 1 egg has 6 grams of protein. So to get 30 grams, which is what I like people to have for breakfast, they've got to eat 5 or 6 eggs. And that's not realistic. Usually. You can do it if you want. Now, that's what I eat. I have an omelet, a 3-egg omelet with some cheese, maybe a side of bacon, sausage. I don't worry about the fat. I don't worry about the protein. I don't worry about the fat. Don't worry about the carbs. I worry about the protein. I try to get 30 grams of protein in with breakfast. It really sets your metabolism up for a positive day. But you've got to work on that to get to that level. So what do I recommend people do on the GLP-1 drugs? Because they're not going to be hungry. You're going to have to force yourself to eat 30-gram protein breakfast. 5 or 6 eggs or an omelet with some breakfast meat. You don't need the toast, the potatoes, just have the omelet, breakfast meat. And then we're going to have protein for dinner. That could be a steak, chicken, fish, maybe a side vegetable. But during the day, you're still going to need more protein. I like venison jerky sticks. Those have 9 or 10 grams of protein typically, maybe some more, some less. A couple of those a day, maybe 3 or 4, and maybe a whey protein shake. That's how I get somewhere close to that 1 gram per pound of body weight. But this is work, and it's something you have to really work on. You can get protein from vegetable sources, beans, legumes, soy, tofu. I'm not a big soy tofu guy, but there's protein in it. But not all protein is equal. Plant-based protein is less bioavailable than animal-based protein. So I do try to educate my patients to eat more animal-based protein. And of all the proteins, especially to start your day, eggs are the best. You want to get farm-raised, organic eggs. Have a deep yellow, almost orange yolk. Oftentimes the shells are brown, that are raised without chemicals, where the chickens are free-range. Maybe you know a farmer that does those kind of eggs. You can get them in the grocery store. They're just a little more expensive, but they taste great, and they're good for you. You can whip up 5 or 6 eggs in an omelet real quick. Maybe 5 or 6 is too many. Maybe start with 3 eggs. Then you add a breakfast meat, a couple of pieces of sausage or bacon with it. Don't worry about the fat. Worry about the protein. It's critical you get amino acids. Amino acids are the building block of muscles. And even if you're not on GLP-1 drugs, if you're over the age of 50, especially in the 60s or 70s, you need more protein. This is why people waste away as they get older. You've seen this with your parents and grandparents. As they get older, they start losing the muscles between their fingers. Their arms and legs shrivel up. They become a shadow of their previous selves. They just aren't eating protein. And there's this anabolic resistance that increases with age that makes it harder to build. Anabolic means to build. So it's harder to build muscle. So not only do you have to use your muscles, which is critical, you've got to exercise. You also need to give your body the amino acids, especially methionine, leucine, and lysine. Those are really strong meat-based proteins, not as available in plant-based foods. So sit down. You can get on the internet. You can Google how to eat more protein in my diet. What is a high-protein diet? But be very careful. The RDA is going to be about 60% less protein than what I'm talking about. This is 2.5 to 3 times, almost 3 times as much protein as recommended. Now, if you have any kidney problems, liver issues, you should talk with your doctor. This may not be the right option for you. We would go through those things with you at Wycoff Wellness before we got you on the program. But for most people who have healthy metabolism, healthy kidneys, you can eat a lot more protein, and you need a lot more protein, even if you're not on GLP-1 drugs, especially if you're over 50 to maintain muscle mass. Eat more proteins. And it's really critical in the morning that the first food that crosses your lips is protein. Eggs are one of the miracle foods that you can have. I have eggs every day. Don't worry about cholesterol that is overrated. Dietary cholesterol in foods does not contribute to heart disease. You're going to get 9 essential amino acids, get healthy fat, and you're going to start building muscles. So have 3 eggs with some sausage. Have a 3-egg omelet with some meat and cheese in it. Have an avocado. Have some berries. That can be a great nutritionally sound breakfast to get you started and set your metabolism for the rest of the day. That is so critical for everyone, but especially people on GLP-1 drugs. So we don't want you to lose muscle. Muscle has weight too. So you might see the scale going down and be excited, say, oh my gosh, I lost 2 more pounds. But if 3/4 of that was muscle loss, you really have put yourself at a disadvantage. It can be very easy for the weight gain to come back. And that's another issue we should talk about is what happens when you stop the medication. Well, some people can't stop, but I'll be very honest, majority of patients who have had significant weight loss, let's say over 20 pounds, and have maintained that weight loss, if they stop the medication completely, oftentimes the weight gain resumes, no matter how many lifestyle changes are made. The reduction in food cravings, the food noise I talk about, goes way down while you're taking the drug. That can slowly come back. And as it comes back, those old habits come back, and you start finding that you need to munch on those carbohydrates, and slowly but surely you get off some of those healthy habits you had, and you start to gain weight. So you may not have to stay on the medication for life, but I have many patients that have really said they will never stop the medication, because what you may not understand is that when people are on a GLP-1 drug, they have the ability to control their appetite, control their eating, control their hunger. And for many of them, it's the first time in decades or maybe their entire lives that they've had that feeling. It's the feeling of control, and they don't want to give that up. So we had this discussion with all of our patients when they've met their weight loss goal. We talked to them about exercise. It's important that they keep moving, aerobic exercise, resistance exercise. We talked to them about a high-protein diet. We talked to them about, can we reduce the dose? And oftentimes we can reduce the dose. We'll do that under our supervision, and we'll get you down to a maintenance dose. Again, kind of that low dose or micro-dosing. We're probably going to keep you there, though. Doesn't mean you can't stop it. You can stop these drugs cold turkey any day. If you don't have diabetes, there's no negative side effect except you're going to start to crave, and you're going to want to eat more, and you're going to gain weight. So talk with us. We're there to help and support you. Many people are finding that it's just the way their metabolism is. They need to stay on GLP-1 drugs forever. Now, right now, there is no oral form of GLP-1 drugs. They're in development, but my understanding is they've not been terribly effective yet. So currently, we all are using the once weekly GLP-1 drugs. There are 4 of them. Ozempic and Wegovy are made by Novo Nordisk pharmaceutical company. The Mounjaro and Zepbound are made by Eli Lilly. Zepbound may have some very subtle difference in that it works on 2 different receptors. Some people find that it's a little bit more effective. In clinical trials, people did lose a few extra pounds on Zepbound and Mounjaro. So we have many patients that reach a plateau, or they just don't do well on Ozempic or Wegovy, semaglutide. We'll change them to Zerzepatide, either the compound or the prescription form, and they'll do well. So again, let us help you in that process. If you do well on semaglutide, we're not going to change it. If you're losing weight, you're not having side effects, you're feeling good, then that drug is going to work for you. So again, this is Dr. John Wycoff. Our practice is the Wycoff Wellness Center in East Lansing, 1226 Michigan Avenue, East Lansing, Michigan. We're right on the edge of the campus, just east of Highway 127 and west of Harrison Road. We can be reached at 517-333-7270, 333-7270, or 800-471-0255, or learn more about us at wycoffwellness.com. A lot of information on our website, but give our office a call if you want to learn more about our approach to healthcare, getting you healthy and well without taking all unnecessary medications, and what alternative treatments may be available for your chronic health issue. That's what a functional medicine doctor does. That's what we do at Wycoff Wellness each and every day, and it would be a privilege to see you. So I'm going to wrap up this podcast. There is another podcast that talks about the GLP-1 drugs and weight loss. It's kind of a primer, introductory. I would encourage you to listen to that. It's probably less than 30 minutes. And like I said, this is a little bit more of an advanced drill down discussion on GLP-1 drugs. We'll call it the GLP-1 202 update. And I'll probably end up doing another one in 6 months, because this is a rapidly evolving area. If there's any area of medicine right now changing faster, there just isn't. So we're finding more and more benefits of the medication. We should talk just about side effects. These drugs have been around in this form for now 8 years, since 2017. But the first generation of GLP-1 drugs been around since around 2010. So these aren't brand new drugs. And we're finding that long-term that they have no negative side effects, and we're finding more and more positive things. They may indeed be the fountain of youth drug we've been looking for. So with that, I wish you a great day. Keep listening to Pathways for Wellness with Dr. John Wycoff.